Okay, so continuing with the again the histological classification. So we have compact bone, which is also called as the dense bone. So here, let's see the photos. This is the compact bone, right? This is the compact bone. Also, it's called as the outer bone, okay, outside, and it's rigid, it's hard. So this bone is harder and denser. Its example is shaft of long bone. So the long bone, right? The shaft of the long bone is usually compact bone. Okay, it's the compact bone. Okay. Now spongy or cancellous bone, that is jua inside. Okay, spongy or the cancellous bone is inside. So the bones are bigger. They have bigger marrow spaces and they are less hard. Okay, they are less hard. Okay, so that is ends of long bones. Ends of long bones. So if you see the end of the long bone, you can see that this is the inner aspect. Okay, so these are the inner bone and the porous part of the bone. So these are the spongy bone. Is it clear difference between compact bone and spongy bone? So compact bone is the shaft of the long bone. Okay, it is hard, it is rigid, okay, denser. Whereas inside you have spongy bone. Sponge, a sponge. Okay, it's, I mean, it's very soft. Okay, it's cancellous bone and it's end of the long bones. Okay, so that's the location for the two bones. Fine. Now coming to structure of the compact bone. So we have three systems over here. We have it's called circumferential system, and it goes like a circle, so it's called circumferential system. Outer periosteal and inner endosteal. Okay, outer periosteal and inner endosteal circumference. Okay, circumferential system. Then you have Harvation system. The Harvation system is also called as osteon. Okay, it's also called as osteon. And in between the two, we call it as interstitial system. Between the two, we call it as interstitial system. So there are three systems. Circumferential system. Okay, so that is the outer one, outer periosteal. Okay, so that's the outer periosteal. Okay, and then you have inner endosteal. Inner endosteal. Then in between, you can say that there is the Harvation system. So that's the Harvation system, like this in between. Okay, then in between the two, that is the circumferential and the Harvation system, in between you will find the interstitial system. Okay, so one in pink will be the interstitial system. Is it clear? Okay, so the one which I drew in green, that is the outer periosteal and inner endosteal. Okay, then I said these are the Harvation, and then in between them is interstitial system. Okay, moving on. Okay, so let's identify the structures. Okay, so what is this? If I draw this like a box, what is it? Hmm. No. Thank you, Fahad. Harvation system. I also called as osteon. Yes, that is Harvation or a osteon. Okay. Harvation system or an osteon. Is it clear? Okay, good. So all this, which I'm drawing in yellow, sa, adi kullu Harvation system. Okay. All these are the Harvation system. Another name is osteon. Is it clear? Okay. Right. Now, okay, let's go to details about what is a Harvation system. So a Harvation system consists of, okay, we have this in the center, right? This is called Harvation canal. Ishmo Harvation canal, right? In the center we have Harvation canal, and around it, okay, around it we can see it's called concentric lamellae of bone. Concentric lamellae of bony matrix. Okay, so you can see like all this is circles, circles. These are all bony matrix. Fahamt, all of you clear? Okay, so there is Harvation, presence of, like I'm just reading this sentence. Okay, presence of Harvation system with Harvation canal in the center and concentric lamellae of bony matrix. Concentric lamellae of bony matrix. Yes, very good. Now, what is a Workman's canal? Workman's canal. D. Okay, this is a Workman's canal color. Okay, Workman's canal is a communication between two Harvation canals. Between two Harvation canal is more Workman's canal. Clear? Okay. Now, if you find some cells in between, okay, that they are called as interstitial lamellae. Interstitial lamellae. So where are they? Here. And a location is here. They're like in between. So these are called interstitial lamellae, which occupies between the Harvation systems. Kulu fahamt? What is this yellow box again? What is the yellow box? Osteon, okay, or Harvation system. And it consists of one Harvation canal and concentric lamellae of bone. Okay, yes, concentric lamellae of bony matrix. Is it clear? And what is Workman's canal? Workman's canal is communication between two Harvation canals. Okay, what is interstitial lamina? It's right in the in between. Okay, yes, Hamza, this will be one of your histology slides. Okay, one of your lab slides. Clear? Okay, so note it down. Next, let's move. You have a doubt, Renat?
Doctor, are the all the little black dots, are they all interstitial?
No, not all of them. Not all of them. Okay, you have to learn it, like you have to understand, or kind of view it.
And the
Like,
black line is the Volkmann, right?
yes. Okay, see here. One second. Now, did you understand this? See, in this box which I drew, the yellow box, okay? All these cells belong to Harvation system, belong to the Harvation system. So here we see the black dots, what you're saying. Okay, but they are belonging to this particular Harvation system. Yes or no, Renad?
Yes, doctor.
Okay. So if you have some cells right in between, yeah, it's just in between, not in included in any Harvation system, then they are called interstitial lamellae. Interstitial means like it's like in between. Okay.
Okay, thank you.
Okay, moving on. Fine. Next. Okay, now coming to, we finished with compact bone. Okay, so now we come to spongy bone. Okay, and also I have mentioned this word decalcified section. Okay, so you see the compact bone, it was in the black and white, right? Because it was calcified section. It is called as a calcified section. Okay, so that's why we are not able to stain it with hematoxin eosin. So, so the bone, since it's very hard, we have to first do decalcification, and this procedure has to be done. Then we stain it with hematoxylin and eosin. Then we get this pink and blue appearance. Okay. So anyway, spongy bone is having this decalcified section because it's more softer. Okay. Fine. Now, what do we see here? Okay, so let's just directly go into the diagram. So what you see, all these dark lines, right? Dark pink, huh? These are called as bony trabeculae. Ishusmo bony trabeculae. Okay, they're called bony trabeculae. Okay, and what do you see? All this, can you see here in between? Okay, what does it look like? Can you see all these white spaces? Yes, it's bone marrow. What white spaces? Any other name you can give me? Okay, you can see lots of fat cells, right? Adipose cells. Huh, Valla? Yeah, adipose. Yes. So the bony marrow, and it has, or obviously it has a lot of adipose tissue over here. Okay. So this is called as the marrow space. You have bony trabeculae, the dark pink, and in between them you have this space is called the marrow space, which contains bone marrow. It contains bone marrow. Okay. Is it clear to all of you? Now, if you go to details on the trabeculae, on the bony trabeculae, we can see that externally it is covered by vascular endosteum, and it has all these cells. It has osteoprogenitor cells, osteoblast, and osteoclast. Okay, so these cells can be seen in a closely. If you in next view, we can see them. Okay, so what do we see? The dark pink are called as bony trabeculae. Spaces in between are called as marrow spaces, and there is bone marrow in between them. Okay, so I hope again, you can remember it well. So this is, yes, this is also another slide for lab. Okay, next, moving on. This also you can remember. Anyway, the spongy bones, this is a little higher magnification. It's also decalcified section. Whenever you see this pink and blue, that means it's decalcified. Okay. There is absence of Harvation system. You don't see those circles, right? You don't see those circles. So there is absence of Harvation system and the lamellar arrangement. Lamellar means like those circles which we saw in the previous. Okay. Not this, the previous, not, wait, not this one. Okay, so this is called as lamellar arrangement. Harvation system and the lamellar arrangement is not present in the spongy bone. Okay, we can see osteoblast and osteoclast on the surface of the bony trabeculae. Okay, again, it's maybe not very clear here. Osteocyte, can you see this cell over here? These are called osteocyte in the lacuna. It's the osteocyte in the lacuna. Ish meaning lacuna. The space, the white space is called as lacuna. Okay, so if you see any cell on the surface, they are the osteoblast, and if they are supposed to be a little large, it will be the osteoclast. Is it clear? See, again, I'm telling you, maybe like in histology, I showed you that previous diagram, and somewhere in between, I showed you, right, how the osteoblast looks like, how the osteoclast looks like, osteocyte looks like. Okay. In pathology, maybe they will focus more because they have, when they have tumors and all that, they can show you more details. Okay. So that time, don't forget these things which you have just seen. Okay. Osteocytes are seen embedded in the matrix of the trabeculae. So these are osteocytes. Location of the osteocyte is in the matrix, in the bony matrix. Osteoblast and osteoclast, we said, is on the surface, right? Is on the surface. These are all adipose cells, okay, adipocytes, which you're seeing. Right, moving on. Students sleeping or awake or what you're doing? Okay, inshallah, last 3 slides more. Okay, 3, 4. Now coming to cartilage, so we have just 3 types of cartilage. We have hyaline cartilage. Okay, so if you remember, where did we see this before? Min zaman, we saw in trachea. Okay, so we saw this in trachea, and now also remember it is present on the articular cartilage. Articular cartilage. Okay, so hyaline cartilage. Example, yeah, means also location. So location and example are the same. Okay, so what do we see here? This is perichondrium covering the cartilage. Ismuhadi perichondrium. This is dark, blue or purple. So this is called basophilic matrix. These are called basophilic matrix. And what do you see here? This is called isogenous groups of chondrocytes. Isogenic groups of chondrocytes. Okay. So these are the groups of cells over here. Okay. Next, moving on. Hyaline cartilage is clear, right? Okay. By the way, this is also for your exam. Okay. Next. Oops. Uh, Next is elastic cartilage, right? Elastic cartilage. So elastic cartilage, we have location, fill E. Remember, ear pinna and epiglottis. Ear pinna and epiglottis. Also the slide for your exam. Okay, histology. Here we have the again, it has perichondrium. We have chondrocytes with eccentric nuclei. Eccentric nuclei. So this is an elastic cartilage. Okay. Next, moving on, we have fibrocartilage. Okay, fibrocartilage. This slide also for your exam. I mean lab. Okay, and then the location is intervertebral disc. You see presence of dense bundles of collagen fibers. Okay, here we have collagen fibers. These are all collagen fibers. This is a different staining, special staining when compared to this hematoxylin eosin. And you can see the chain of chondrocytes between the collagen bundles. Okay, and there is absence of perichondrium. There's no perichondrium. By the way, here in elastic fiber, there is, sorry, elastic cartilage, there will be elastic fibers. Okay, it's not mentioned here, but it should be there. Okay, anyway, because the word elastic cartilage mojud, all this pink, dark pink you're seeing, right? So that is elastic cartilage. That is elastic. You want me to write it, or you'll, sorry, not elastic cartilage, elastic fibers. Okay. Okay. I just mention it, just write it down. There is also elastic fibers. All this dark pink you're seeing, that is elastic fibers. Here, There is no elastic fibers here, it's collagen fibers. Okay, here doctor, we didn't mention ear pinna. I think I said ear pinna and epiglottis, ee. Okay, elastic cartilage example with both the e's. Okay, ear pinna and epiglottis. Yes, we finish next. Osteoarthritis, which is a clinical anatomy related to this. It's a clinical syndrome manifested by joint pain, loss of joint form and function caused by degeneration of the articular cartilage. Okay, so you remember that the articular cartilage, it's made up of hyaline cartilage, which we just said. Okay, and if this is, degenerated, this part is degenerated. Let me get the. Okay, so as you see here, this is normal cartilage, and here you can see that the cartilage is it's degenerated. Okay, so because of this degenerated cartilage, this will cause there's difficulty in the movement and there is pain. Okay, so there is loss of movement, and there will be pain. Okay, yes, there could be crack sound also. So here you can see this is a normal joint. See this? This is a normal joint. This is a cartilage. Okay. Over here, cartilage lining. And here what has happened? The cartilage is lost. And because of that, the or it's written as thin cartilage. So the cartilage is very thin over here. And the joint space, this is called as a joint space in between, right? The joint space is also reduced. Okay, and it will cause severe pain. Okay, and there is also, because of this continuous friction between these two bones, it causes something called as bony spur. All this you will study in more detail with pathology. Okay, so that is one of the features of osteoarthritis. Okay, so when the bones will rub together, they form this bony spur. Okay, yeah, by this we have finished, right? Okay, lab slides. Okay, this is a lab slide. So we have three, this one, then this one, all these three cartilages are coming under that. Then you have the bone. Okay, so you have this is the spongy bone, these two spongy bones. Then you have the compact bone. Okay, till here it's finished. Then you have actually the muscle. If you see, it's just one slide. Okay, the muscle, where is it? Right in the beginning. Okay, yeah. Okay, so that's all you have for histology and histology slides. Okay, and the question for Muad. This is a both lecture and practical slide, lecture together. Okay, so you focus on the practical aspect about MCQs. Mostly it may not come. Okay, but I cannot 100% guarantee right now. You just focus on the lab slides. Is it clear? But it will be a review for you, and you can understand the other concepts in pathology, I hope. And there is one concept which I have not told, and I just want to mention it before I stop. Okay, so there is I need some space for that, just a sec. Okay, okay. Okay, so there is another terminology which they will use. Okay, this I want to just mention. Okay, it's called as, okay, I'm writing it here. It's called as the woven bone. Okay, woven bone also is, it means, woven bone also means the young bone. Okay, so you can remember it as primary bone. You can remember it as the primary bone. Understand? Okay, and it will be very weak, obviously, because it's young, weak, and it will be flexible. Okay, whereas the second type of bone is called as, that is, the woven bone gets converted into lamelllar bone. So this is like a stage of development. Okay, so first the bone is called as a woven bone when it's a young bone or a primary bone, and then it's called as a lamellar bone. It is usually formed due to remodeling, okay, of the woven bone, remodeling of the woven bone. Okay, and it's also called as secondary bone. Understand? secondary bone. Okay. Now this secondary bone is further classified into spongy and compact bone. Is it clear? Okay. So first we have a young bone, is more woven bone. It's a primary bone, weak and flexible, and then it gets converted into lamellar bone, um, which is like because of remodeling of the woven bone. That's how we get the lamellar bone. It is a secondary bone, and this is further classified into spongy and compact bone. Okay, yeah. So because when they again during development they use this terminology, there is woven bone increase or lamellar bone is increased like this. Okay, so I hope you understand these terminologies also. Is it clear to all of you? Fine. Yeah, we finish. Okay, so inshallah there will be, like I said, just maybe one or two question from the lab. Okay, uh, because Dr. Salah usually likes to keep one histology, maybe one embryology he may add inside. Okay, we will let you know. Okay, so it's very easy. Just to review everything and be ready for tomorrow's lab. I hope you've already gone through there is a video also, and then there is also the lecture. Dr. Salah has put it up also. You can review and come. Okay, thank you. Any other questions? Welcome. Please, again, all of you, I don't know how you feel about musculoskeletal. Maybe you've already listened from other students or whatever. You have to work a little hard. There's lots of names you need to study. Okay. um, and the histology bus, this is the only lecture you have. That's it, you're finished. Okay. Yeah, there's only one lecture. Okay. I was just saying that you need to just revise every day regularly, and don't feel worried, and inshallah, like because of lots of revision, you will be able to get through musculoskeletal well. Okay. Most probably no. Okay, this lecture will not be included. Most probably Dr. Salah usually does not ask questions from this lecture. Okay, but if there is any change, I will let you know. Right now focus only for the lab. Clear? Okay, so I'm closing now. Okay, thank you.